We present a novel repair of a scleral melt from recurrent scleritis secondary to granulomatosis with polyangiitis, treated with a scleral patch graft 3 years prior. Upon initial assessment, the patient had count fingers vision and an intraocular pressure of 2 millimeters of mercury secondary to scleral melt. First, an area of scleral melt was identified on the superior aspect of the globe. Conjunctival dissection to bare sclera was conducted with blunt Westcott scissors. Blunt dissection with a Q-tip applicator was then conducted to expose the remnants of the previous patch graft. Eraser tip cautery was then used to achieve hemostasis. Using an automated keratome, a donor cornea was dissected, removing the anterior 350 microns of cornea, leaving the posterior cornea with the original scleral skirt. The donor corneal scleral skirt was then trimmed and debulked with laminar dissection to oppose the limbus in a more uniform configuration. 9-O-ethylon suture was then used to anchor the anterior portion of the corneal scleral patch at the limbus. 8-O-ethylon suture was then used to anchor the posterior portion. Eviseal glue was placed under the donor corneal scleral patch to promote adhesion. Next, an 11mm scleral patch was then placed on top of the corneal scleral patch and secured in place with 10-O-ethylon and Eviseal glue. Amniotic membrane was then cut, trimmed, and placed over the entire patch complex and secured in place with Eviseal glue. 8-O vicryl sutures were then used to close conjunctiva. Subconjunctival cefazolin and dexamethasone were placed at the end of the case. 2-month follow-up revealed 20/60 pinhole vision with an intraocular pressure of 11 millimeters of mercury on the affected eye. In combination with surgical management, the patient was treated with IV solumedrol acutely and tapered to oral steroids. She was also treated with 3 rounds of cyclophosphamide while transitioning to long-term immunomodulatory therapy, which currently includes Imuran and rituxomab infusions with low-dose oral prednisone.